Hi, today I want to share something really important with you, something that could make a huge difference in protecting your kidneys. There are 7 common medications that can silently hurt your kidneys, and if you care about keeping them safe and strong, you need to know about them right now. I'm not exaggerating when I say this may be one of the most important steps you can take to protect your kidney health or even to repair damage that's already been done. And yes, this matters not only if you already have kidney issues, but also if your kidneys are still healthy. You see, whenever someone asks me, what can I do to improve my kidney function, one of the very first things I remind them is to take a close look at their medications. Because the wrong pill, one of the 7 I'm about to show you, can harm your kidneys quickly, sometimes without warning. And here's the scary part. Most of these drugs are used by millions of people all over the world. That's why I hope you'll also share this video with anyone you love, because protecting your kidneys often starts with simply knowing what to avoid. Always remember this: whatever medicine you take, whether it's over the counter or a prescription, your kidneys have to process it. That's why today, we're going to focus not just on what can harm them, but also on how to lower creatinine and strengthen your kidneys naturally. So, what are these kidney-harming medications? Let's start with a controversial one, a drug that many people take for cholesterol. It's often prescribed as if it's supposed to protect your kidneys, but does it really? Science number 7, statins. Let's talk about statins. You've probably heard of them. They're some of the most commonly prescribed drugs in the world for lowering cholesterol. But here's the big question: can statins actually harm your kidneys? According to a major study published in the BMJ, people taking high doses of statins were 34% more likely to end up in the hospital with acute kidney injury, sometimes within just the first 120 days of treatment. Even 2 years later, their risk remained higher compared to those on lower doses. Scary, right? Now, why does this matter so much for us? Because if you have kidney disease, you're already at higher risk for heart problems and high cholesterol. And that means there's a very good chance your doctor may prescribe you one of these drugs. There are 7 types available in the US, names like simvastatin, levastatin, pravastatin, and others you've probably heard before. Here's the tricky part: doctors do know about some of the risks. That's why they usually check your liver enzymes when you first start statins. But kidney damage? That's a newer concern, and it hasn't always been taken into account. So what should you do if you're already on statins? Please don't just stop taking them. That could put you in real danger, especially if you also have heart disease. When a doctor prescribes a statin, it usually means they've judged that the benefits outweigh the risks for you. That doesn't mean they're perfect, it just means they're trying to balance protecting your heart with protecting your kidneys. But here's the good news: you're not powerless. There are safe, natural ways to lower cholesterol and reduce your reliance on these drugs. Simple dietary changes, adding the right foods, and making small but steady lifestyle adjustments can make a big difference. So yes, a pill that's supposed to help your heart and protect your kidneys may actually harm them. And that's why statins are number 7 on our list. But if this is only number 7, imagine what's still ahead. Number 6, ACE inhibitors. Now let's talk about ACE inhibitors. Just like statins, these drugs can be both helpful and harmful when it comes to your kidneys. ACE inhibitors work by slowing down the activity of a certain enzyme called angiotensin-converting enzyme. You don't need to remember all the details. The important thing to know is that they're very commonly prescribed for high blood pressure and heart failure. And here's where it gets tricky: high blood pressure is extremely common in people with kidney disease. So doctors often prescribe ACE inhibitors, but these drugs are processed by the kidneys. And when a medication is metabolized by the kidneys, there's always a risk that it could harm them. This risk is even greater if you're dehydrated, which sadly happens often in people with kidney problems. The names are usually easy to spot. They tend to end in IL, like lisinopril, enalapril, or ramipril. If you need an ACE inhibitor, doctors will usually start you on a low dose and keep a close eye on your kidney function with regular blood creatinine tests. That's because, yes, they know these medications can cause damage. The tough part is that sometimes not taking them could be even more dangerous, especially if your blood pressure or heart health is already at risk. So, it's a delicate balance. ACE inhibitors can help in many cases, but they can also harm. And as careful as you need to be with them, the next drug on our list is far worse. Unlike statins or ACE inhibitors where the debate is still ongoing, number 5 is a medication with kidney damage risks that are already proven. Number 5, antibiotics. Now, let's talk about antibiotics. Unlike statins or ACE inhibitors, there's no debate here. Antibiotics can be flat out dangerous for your kidneys. In fact, if they're misused, they can even be lethal. I'll share something personal. Someone I know had to stay in the hospital for an infection. They were put on a long course of antibiotics. Of course, the doctors were monitoring their kidneys, but it still wasn't enough. The antibiotics did damage. And that's the reality. Antibiotics are powerful medicines, but they need to be treated with respect, almost like poisons. The problem is, most people don't fully understand how risky they can be. And that's even more serious if you already have kidney disease. Antibiotics can harm your kidneys in different ways. Some can form crystals that block urine flow. Others are directly toxic to the cells inside your kidneys as they try to filter the drug out. These risks become much higher if the dose is strong, or you're on them for too long. Let's look at some of the worst offenders. Vancomycin, often used to treat intestinal infections that cause diarrhea. But it can also trigger kidney damage or swelling in the kidneys. If you're ever prescribed vancomycin, your doctor should be watching your kidney function very closely. Aminoglycosides. These are broad-spectrum antibiotics, and they're notorious for harming kidneys, even at low doses. The most toxic is neomycin, followed by gentamicin, tobramycin, and amikacin. Streptomycin is a bit safer, but still not risk-free. These drugs are commonly prescribed in hospitals, so you really need to be aware of them. So, what can you do to protect yourself? First of all, never take antibiotics unless your doctor is absolutely sure you need them. And if you have kidney disease, your dose should be smaller than what's given to someone with healthy kidneys. Always keep track of your kidney function. Know your stage, your latest lab results, and bring them with you to your doctor or pharmacist. That way, they can adjust your prescription safely. And of course, only take medications that have been prescribed specifically for you. Antibiotics save lives, but for people with kidney disease, they can also take a heavy toll. And that's why they've earned their place at number 5 on our list. Number 4, PPIs. Next on our list are PPIs, that stands for proton pump inhibitors. These are the pills people take for heartburn and acid reflux. They're everywhere. And yes, they work, but here's the problem. Study after study has linked PPIs to kidney damage. And this risk isn't only for people who already have kidney disease. Even people with perfectly normal kidney function have developed chronic kidney disease after taking PPIs long-term. That's scary. Drugs like Prilosec, Nexium, and pantoprazole are all part of this group. So, if your doctor prescribes you one, make sure to ask why you need it, and stick carefully to the recommended dose and duration. These are not pills you want to be on longer than absolutely necessary. Number 3, NSAIDs. Now let's move on to one of the worst offenders for your kidneys, NSAIDs. If you've been around people with kidney disease, you'll notice a pattern. So many of them were regular users of NSAIDs before discovering their kidney damage. That's how dangerous these drugs can be. And here's the thing, NSAIDs are everywhere. You can buy them over the counter, which makes people think they're safe. But they're not. Medications like ibuprofen, Advil, Motrin, naproxen, Aleve, and aspirin, Bayer, Bufferin, can all cause serious kidney damage if taken too often or for too long. This isn't just speculation. Thousands of people have hurt their kidneys by using NSAIDs daily for chronic pain. Studies have proven their toxicity. And remember, just because you don't need a prescription doesn't mean the drug is harmless. Now, I know what you might be thinking, but I take them because I need them. And that's fair. The good news is that there are options. For example, Tylenol, acetaminophen, works differently and can sometimes be used in combination with NSAIDs, which may lower your dose. Doctors often recommend this approach, though it comes with its own pros and cons. There are also herbal remedies and alternative treatments that can help with pain management. The important thing is this: if you're relying on NSAIDs regularly, talk to your doctor about finding a way to cut back or stop. The risks for your kidneys are just too high to ignore. Number 2, contrast dyes. This one isn't a drug, but it's so dangerous for your kidneys that I simply can't leave it out. Contrast dyes. I'm talking about those tests where doctors inject a dye into your vein, like CT scans with contrast, cardiac angiograms, or even certain MRIs. These tests are done every single day, on millions of people, and yes, they can provide life-saving information. But here's the hidden danger: the dye used to make those images clearer can cause serious damage to your kidneys. I've seen this happen myself. There was a patient in stage 3 kidney disease who went in for an angiogram. Less than a week later, they were on dialysis. That's how fast this can happen. So what can you do if your doctor recommends one of these tests? First, know your numbers. Know your GFR, know your creatinine. Share them with your doctor before the test so they understand the risks for your kidneys. Make sure the doctor ordering the scan is fully aware of your kidney condition. That way, they can take precautions to protect you. One of the most important precautions? Hydration. Drinking lots of water before and after the test helps your body flush out the dye. We're talking about serious hydration here, about a gallon the day of the test, and another gallon afterward. The faster your kidneys clear out the dye, the safer you'll be. So here's the bottom line: avoid these tests with contrast whenever you can. But if you absolutely have to do one, take every precaution possible. Protect your kidneys first. Number 1, drug interactions. So, what could possibly be worse than contrast dyes? Here it is: drug interactions. This one happens far more often than most people realize. Many patients need more than one medication, and that's where the danger begins. When you take several drugs together, one can change how another works. It can make it stronger, weaker, or in some cases, toxic. And sadly, it's usually the kidneys that pay the price. Now, I don't expect you to memorize every prescription you take or all their possible interactions. That's your doctor's and pharmacist's job. But you can help them do it right. Here's how: bring a complete list of everything you're taking, every prescription, every supplement, and why you take them, along with your latest lab results, every single time you visit your doctor. This way, they have the full picture. If you already have kidney disease or reduced kidney function, this is even more critical. You often need lower doses, and your doctor needs to know exactly where your kidney function stands before prescribing anything new. And here are 2 simple but powerful questions to always ask. Can I take this safely with my other medications? Are there any foods, drinks, or supplements I should avoid with it? It may feel small, but these questions can literally save your kidneys. So please be cautious, be proactive, and protect yourself. That's all for today. Thank you so much for watching and for taking the time to care for your kidneys with me.